Yes, good afternoon. My name is Nora Howley. I'm the Interim Executive Director of Action for Healthy Kids. I want to thank the Chair and the members of the committee for this opportunity to testify, and we have provided a written statement. Action for Healthy Kids is a national organization with over 9,000 volunteers in every state and the District of Columbia. We also have 60 national partner organizations who work with us. Former Surgeon General David Satcher served as our founding chair and still serves on our board of directors. And since our founding at the 2002 Healthy Schools Summit, we have worked to create systemic, sustainable changes of sound nutrition and good physical activity in all schools. In other words, we have worked to implement the Surgeon General's call to action to prevent overweight and obesity. Since the mandate for local school wellness policies was passed in 2004, our volunteer team members have worked at the state, district, and building level to support schools in the development and now in the implementation of good policies that put into practice the call to action, ensure that families and communities are engaged in creating and sustaining these changes. Local wellness policies are part of an effort that includes federal, state, and local actions and are a critical catalyst for creating or expanding links with other community agencies and organizations to create healthy communities for all. 4 things stand out about the mandate. 1, it recognizes the critical roles that schools can and should play in creating comprehensive approaches. 2nd, the policy mandate recognizes that both sound nutrition and physical activity are necessary to address this epidemic. 3rd, the requirement that districts establish committees that includes parents, students, school food personnel, school administrators, school board members, and the community, as well as any other who will be affected, is an important part of creating springboards for sustained implementation. The final item, though, that stands out is the fact that the requirement came with no financial support. Some of the necessary changes will be easy and low cost, but others will take resources. Actions for Healthy Kids has worked with our partners, including the Centers for Disease Control and the U.S. Department of Agriculture, to provide a variety of resources and supports for our volunteers and others to use. This includes our wellness policy tool, a variety of publications, ongoing technical assistance and phone symposia, as well as a small grant program to our volunteers. CDC-supported resources such as the School Health Index and USDA-supported resources such as Changing the Scene have been part of the efforts of many districts nationwide, and we know they have been a critical part of their efforts to create these changes. As we look at this first year of policy implementation, we're heartened by a number of things. First, in our review of a sample of enacted policies, we found that most of the policies actually included the mandatory areas of nutrition education, nutrition standards, physical activity, and monitoring and evaluation. In addition, many of the policies went beyond those minimal mandates to address critical and fundamental areas, including the provision of physical education. However, the contents of the policy are only the first step. For these policies to achieve their potential, they must be implemented, and here we do have some causes for concern. While 73% of the policies we looked at did provide information on the implementation process, many came up short in the details. And while this lack of detail is not an insurmountable barrier, it may make implementation more difficult. We know from practice and research that there are a number of things that are critical to successful implementation of policies in schools. I won't go through my entire list in the interest of time. It is in my written testimony, but it is important to recognize that a policy must be well written and comprehensive. The right people must be at the table for development and implementation. The policy must be understood, and there must be support and commitment from all constituencies. Additionally, we know from the same research and practice that there are a number of things that may impede successful implementation of policies. Costs that are not offset or addressed, a lack of commitment and understanding on the part of key stakeholders, logistical challenges such as space and time, and a lack of clarity. Action for Healthy Kids and our partners have worked hard during the development stage and are now working hard to support implementation. On our written testimony, we've provided a list of some of the numerous things that our teams are doing with their partners to provide those kinds of supports and changes. Some have asked if these policies are making a difference. While it is too early to tell what effect they will have on the rates of childhood obesity and over what time, we do have some reasons to be hopeful, as Dr. Marks noted. But we know, importantly, that they are catalyzing changes in school practice which will be necessary if children's behaviors are to change. They are also catalyzing continued public attention on this issue and causing parents and educators to take a hard look at what they want from our schools. An article in yesterday's Great Falls, Montana Tribune described the 33,000 apples that will be given away to children in that school district as part of promotional efforts to inform parents about the policy. Of course, one apple is not the magic bullet for behavior change, but I like to think that it's the beginning of a cascade of bushels of apples and other healthy choices and opportunities for our kids. Most importantly, the policies have brought together school communities, teachers, parents, school food staff, administrators, and others to create change, and Action for Healthy Kids is pleased to be part of that effort, and we thank the subcommittee and the larger committee as a whole for your continued interest and support on this issue.